Alright, BSI PPE. First thing I'm going to do is use a head tilt chin lift to manually open the airway. I'm going to measure out my OPA. Then we'll use a tongue depressor to insert my OPA.
No gag reflex. Patient accepts.
Alright, then I'm going to attach my mask to my BVM. Not connected to oxygen. Ensure a tight mask seal. And begin breathing at once every 5 to 6 seconds.
Ventilations are being performed without difficulty, and the pulse ox indicates the patient's blood oxygen saturation is 85%.
Alright, then I'm going to attach my oxygen, turn it to a rate of 15 liters per minute. I'm going to continue ventilating once every 5 to 6 seconds.
Breath sounds are present and equal, and medical direction has ordered insertion of a supraglotic airway.
Okay, and I'm going to ask my partner to take over ventilations while I prepare the supraglotic airway. Alright, I'm going to lube the distal tip. I'm going to make sure my balloons inflate as they're supposed to. I hold air. Alright, and I'm going to inform my partner that I am ready, so whenever she gives him one more breath. Alright, so now I'm going to manually reopen the airway, use a tongue jaw grab, insert my tube down, all the way down to the teeth, and then going to put in 60 of air and reattach my BVM, attempting to bag, slowly pulling out while I do that until I get lung movement. There it is. All right, then try to give him another breath. I'm going to go ahead and put the rest of my air in and oscillate, or have my partner oscillate to ensure that I am properly seated. Okay, once verifying that I'm properly seated, I'm going to attach my waveform capnography to my supraglotic airway. And using it to adjust my ventilation rate. Then I'm going to use the Thomas device with the bite block to ensure my supraglotic airway stays where it's supposed to. And I'm going to bag again to make sure we maintain a good airway.
How would you know if you're delivering appropriate volumes with each ventilation?
Adequate chest rise and fall. I'm going to continue watching the capnography.
What would you look for on capnography?
Rates, the CO2 rate, making sure it stays between 35 and 45.